My mom is a nurse, so he was kind of always there, the hospital and all this, so it kind of became like second nature at home to be close to hospitals. So I think that was the way it started. I have a focus on those patients who come with spots found in the lung, what we call lung nodules. I also treat patients with COPD or emphysema and asthma as well. In addition to it, I also perform procedures such as bronchoscopies, which is basically an endoscopy version in the lungs as well. My primary focus is for them to be able to understand what's going on. I think every time someone hears about nodules and you hear about that word, it becomes very concerning. So I make sure that they understand what we're dealing with. I spend extra time to show them the pictures of if they have any imaging done. And then we come together with a plan. I like to say to my patients, you're the captain of the ship. And I love when my patients ask about more questions about their conditions. They are primarily the ones who are going with the treatments. So I spend extra time to make sure they know how to use the inhalers, or extra time to know, to make sure they understand what diagnosis or condition we're treating. The type of approach for patients who are critically ill that we deal when patients come to the ICU is varies a lot based on what is the reason that patients get admitted into the ICU. I always start introducing myself, and I sympathize with them, and I'm telling them, I'm sorry you're here, it's very challenging, and then try to elicit what are the symptoms that they come with. And always, I think it's important to acknowledge the presence of the family. I feel families help us so much to try to take the best care of the patients. Just having the privilege of taking care of them, having them coming back when we have good news for them about any condition that we feel is manageable. But also on the other hand, when there's some more tough times, having them reaching us for advice, or being a member of the team that is taking care of them, I think is something rewarding for me.